Hello, I'm Thanos Kosmidis, and I'm passionate about making an impact against cancer. The cancer industry is large and still growing fast, and pharmaceutical companies are facing a huge challenge, and that is access to cancer patients. And this challenge causes them two specific problems. Number one, new treatments. Clinical trials are struggling to actually get cancer patients participation. Every day that they have delays costs them $8 million. In terms of new treatments, they're currently in the dark. These companies don't really know how the treatments actually affect the quality of life of cancer patients. So let's talk about our solution. And let's start with how things are done today. Today, the only thing linking the patients and the pharmaceutical companies are the medical professionals, and that's for good reasons. We want to complement, not replace that, through an online platform. And the members of this platform are cancer patients, caregivers, who anonymously access specific services, access to expertise, a community of others who understand, information about the disease, and also tools to help them manage their condition day to day. And this is 100% free for them. So how do we make money? Well, throughout all this interaction, we actually collect and aggregate, anonymize further the data, and provide it as a service to our clients, the pharmaceutical companies. So this is our business model. Let's real quickly dive into this, to the business model. And three revenue sources there. Number one, insights. For example, when a patient undergoes radiation therapy, they have side effects, and mobility may be affected. How does that affect them, and what can companies do to actually help them out? Number two, analytics. Connecting all these bits and pieces of data and actually making a difference. For instance, how does taking supplements affect the risk of recurrence in cancer? Third revenue source, getting those treatments out the door faster. The top-down approach has failed, so we're building the platform to actually match patients with trials so that they can initiate the trial recruitment process on their own. And associated with these, there are specific business models tailored to the way that the pharmaceutical industry works and structured around that. Now, clearly, we need an excellent team to make this happen. And we've laid the foundations of such a team, addressing the business, technology, medical oncology, and bioethics aspects. So our Chief Medical Officer has more than 40 years of experience in the clinics and also institutions across the world. Our bioethics expert is acknowledged throughout the European Commission for his work in patient rights and data privacy. And that's not alone. We're actually supported by a top-notch international scientific committee, 30 oncologists from 20 countries, actually including those professors from these schools on your right. They are providing answers to our community, as well as acting as ambassadors throughout their community to spread the word about CareAcross. Now, clearly, this is a large and growing opportunity, so there is competition. And we feel that in healthcare, to actually succeed, you need domain expertise and focus on your target market. So what you can see here is a competitive landscape, so companies from around the world. And essentially, throughout this competitive matrix, what you can see, in terms of access to expertise, in terms of focus on our target market, cancer patients in Europe, we outperform them throughout these parameters. Is that enough long term? Clearly not. So we'll be going two different directions to actually expand and sustain this. One, deeper integration to the healthcare systems. And two, broader support to our patients. CareAcross will be the hub for cancer patient data. Now, let's take a step back. How do we start? We actually quit our jobs to start CareAcross. We had early successes, and after launching our beta version, we had 2 revenue-generating contracts early on. 2015, as you know, got into the MIT competition and had great success with local and international competitions, including the world's largest startup accelerator, Mass Challenge. Where are we now? Already earning revenue, although we're at beta. 2 contracts in place, 3 more being finalized, and our partnerships working for us to actually get the beta request up. All this has been self-funded. And after addressing the Greek market, we're actually planning for 3 further markets in 3 years. And every market we address, we go into a specific cancer type and expanding beyond that. And we actually exploring the US market with all its regulatory aspects and intricacies. And at the moment, we are actually seeing very good growth, and we are looking at all these network effects, all these capabilities and networks that we have, and our partnerships to actually provide very good revenue growth throughout the next 5 years. Let's focus on the competition for a second, because it really helped us step on the gas on this. So it helped us grow our team. We got international recognition, and we more than doubled our client base within this time. And our mentors, two of them are in the pharmaceutical industry, were instrumental in this because they helped us shape our product and service and actually build the business model for that specifically. One of these clients is actually a US company with their headquarters in Europe. This was the best preparation we could have to actually go into what we started last week, the world's largest accelerator in the world, Mass Challenge. Their companies have raised almost $1 billion in 5 years, and this year's cohort is the largest and most global ever. So we moved to London last week to actually unlock the UK market. And we're doing that through partnerships, and we're doing that through ambassadors, getting influencers spread the word about CareAcross, and clearly leveraging the Mass Challenge network of pharma companies and others. So we're 100% committed, dedicated to achieving this. And our vision has a plan. So we started with self-funded efforts, getting good traction, revenue from that. We're currently raising a seed round of €350,000 to help us unlock the UK market faster. We're anticipating a further round of funding to actually expand our services and go globally. And we're looking at an exit through an acquisition either from a competitor or from a pharmaceutical company in the 5 years timeline. So this is our vision, and what we want is make an impact. And the impact of cancer on patients is huge. We want to counter that. So join us in making an impact against cancer throughout CareAcross. Thank you very much.
Thank you, Thano. We are going to move on to our 5 minutes Q&A with the judges. It's counting. The floor is yours, gentlemen. Gentle people.
Next 3 years, as I understand, 15 and 16 is primarily based on Greece, right? Are you planning maybe to have the last quarters of 16 be in UK, right? Mm-hmm. Are you thinking of probably accelerating UK and moving more of the effort there? And how are you ready to do that?
So that's a question that is central to what we're doing, and that's one of the reasons we actually went to the UK with Mass Challenge. The projections are based on accelerating, exactly unlocking the UK market. The UK market is the #1 market in Europe, and it really has a lot of challenges. We feel that we have challenges here. It's very interesting. Cancer is the #1 killer in men in the UK. We were talking to Cancer Research UK. It's the #1 charity in the UK across charities. They raised £500 million from the public last year alone. And they were telling us that 1 in 5 patients, when they go to their GP and they were told you may have cancer, go to an oncologist, they don't go. So we want to make a difference there. And that is a huge market to actually unlock. And that's why we're actually fundraising now to do that faster.
I have 2 questions. One is, what do you mean by integration with third-party systems? And the second is, why are you keen on an exit in 5 years?
Thank you for those questions. In terms of integration, so our plan to actually stay on top of this is to be more central in where the data is being created. And that's clearly not only patient-reported, so there's also clinics and labs that actually create data. So as we go beyond the patient-reported data sets and outcomes, we want to complement the patient data with the clinic's data. Interestingly enough, there is research now from the EU and the States saying that when the standards of care are based on what the patients say, it's higher than when the clinicians say. But we want to complement that. So in terms of the exit scenario, we feel that our approach to actually tackle the European market is key to actually make our competitors see us as a good launch pad for Greece. So for Europe rather. So in terms of the competition, most of them are in the US, and they're, as you know much better than I do, focusing on a lot of issues like Accountable Care Act and things like that. And they don't have the focus to actually go into Europe. Within this time, we want to nail Europe and actually make ourselves a prime target for acquisition.
Hi, Thanos. Can you tell us a bit about how you store the data? What's the format? Is it structured, unstructured? How do you basically communicate with the patients to get the data in the right format?
So there is both structured and non-structured data. So a large part of what the platform does is offers the ability for patients to exchange unstructured, just posting things. So that's very much clear text. But also in terms of to get those insights and get those data points, we're actually getting specific structured questionnaires. And these are longitudinal. And if you look at the way that the trials work today, they pretty much go one direction only and they don't go back. What we have the ability to do is, as we store the data and we work with our clients, is to identify potential trends or correlations to actually draw conclusions from that and then go back. So it's both. One challenge that, when you're dealing with unstructured data is how do you make sense out of all that? And that is a matter of, one, getting domain knowledge into that engine, and two, getting enough data to actually draw out what's in the edges of that distribution. I don't know if I'm answering the question. Thanks.
Well, thank you. Thank you, Thanos.
Thank you.
Your time is up.